Hello everyone, my name is Serio. I'm the cardiologist, one of the cardiologists here at Natividad in Salinas. I've been a cardiologist for a long time, so fortunately, but I know a lot of stuff about cardiology. I was with UC San Francisco before I came here for 10 years, and I still carry the desire to teach, and I'm interested in academic cardiology, not only general cardiology. So anything I'm going to tell you will be based on science, not on personal opinion. I've been working here at Natividad for more than 10 years now, and I truly enjoy it. We have a teaching program here, we have the residents, we have a family practice residency program, and they're wonderful people to work with, and I enjoy working with them, and I learn from them as well. Our job here is not only to teach, but also to provide excellent care for our patients in the area, cardiology and other things. Over the last 10 years, we've managed to collect an incredible group of cardiologists, magnificent people. I think they're some of the best cardiologists in the area, if not in the whole country. So we're happy to work here, we're happy working together, and we're happy to provide the service to all the patients that we have here. Our job again is to educate and prevent and treat, not only treat. So it's very important. Today we had an open house for our employees for that same purpose. It's Valentine's Day today, so it's a wonderful opportunity to get everyone to celebrate correctly. Our employees came through and we went through their histories and any risk factors they have and gave them advice about what they need to do, and I'm hoping that I can do the same thing for you. Heart disease is very common in the entire world. One of the leaders of mortality dying from any cause is heart disease. So it's important to avoid the disease, to try to prevent it as much as possible, more importantly than treating it. There's a proverb in Arabic that says prevention is much more important than treatment, actually. So it is, we carry that along with us. The things to look for in prevention is knowing your risk factors, knowing what you have that puts you at risk for having heart disease in the future if you don't have disease. High blood pressure, cholesterol elevation, diabetes, weight, dietary indiscretions. There are a whole bunch of things that can put you at risk of having heart disease if you have a family history of heart disease. So these things are important to look at and go over with your general doctor, with your cardiologist, and try to see what you need to do to modify these risk factors, to try to avoid them, to try to relieve them or treat them to prevent developing heart disease in the future. The most important thing, probably to start with the simplest things, are the things we talk about all the time, the diet and exercise. Diet means a good, healthy diet. There's not one specific diet that is advertised or pushed by the American Heart Association or American College of Cardiology. They recommend a general healthy diet, meaning low fat, low carbs. Mediterranean diet follows that usual rule. Avoiding animal fatty food, replacing fat with olive oil probably rather than other fats. So polyunsaturated is bad for you. So mixed fats are better, like olive oil. Weight reduction and exercise. Now, exercise by American Heart Association is advised to have a standard aerobic exercise. Walking is the most natural, and it should be at least half an hour of reasonably brisk walk for at least 5 days a week. That's probably the best thing you can do for your health, for your heart health as well as your mental health. And if you take your spouse along, you're doing a good job on your marital relationship as well. So that's all good. I always advise that if you don't have the guts or the energy, get a puppy, and that puppy will force you to go for a walk every day. Anything you do to get you busy and get you happy. So exercise is important. Diet, like I said, is important. Weight reduction is important, and weight reduction is a combination of both exercise and diet. Exercise will not get your weight down. You need to lower your carb intake to be able to lose weight. Now, other risk factors, diabetes it goes without saying, is a no-brainer. You need to have your diabetes prevented and treated. It's very essential. People who have diabetes don't die from diabetes, they die from heart disease. So it's important to treat diabetes to prevent heart problems in the future. Your cholesterol has to be checked and properly treated. There are a lot of fear about treating cholesterol, and most of this comes from unscientific, biased information. Most of the medications, especially statins that we use for lowering your cholesterol, are completely safe. Most of the risk factors that people talk about are minimal or actually exaggerated. So I would always err on taking the medication if you need it rather than not taking it. So be careful that your lipids have to be well controlled. Again, that's very important. This is one risk factor we can actually adjust and make a difference in your outcome. So do not ignore your lipids, your cholesterol. Smoking is essential, but we're lucky we live in a country where there's a lot of push advertising, taxing on cigarette smoking. So people are doing a good job, a much better job than they're doing in Europe and other places. So smoking cessation is essential. I think we're doing better than other countries. We can probably do better as well. So if you're a smoker, keep that in mind. I know our smokers always are bombarded and they feel bad about what they're doing. They feel guilty already, but it's true, it is important. Not only for heart disease, but for other problems, lung disease and cancer and so on. And I'm sure there's plenty of information about cigarette smoking that is very important. Family history is important. Unfortunately, we cannot avoid that. We cannot change it. Sorry. Age is important. Also, I cannot change that. We're all getting older and we all have more risk when we get older. So these are non-modifiable risk factors. The risk factors that we can change are really important. Like I said, the diet, the exercise, the cholesterol treatment, treating your diabetes, and treating your blood pressure. So if you have high blood pressure, also is another risk factor, and it's important to be treated. And the best treatment for that is starting with is the diet and the exercise. So we're going back to diet and exercise, and if needed, medications. So your general doctor will be the perfect person to help you with that. So treating high blood pressure can prevent not only heart disease, but stroke, kidney disease, and other problems. Some people have other issues, sleep apnea and other problems that have to be addressed because they all can affect heart problems, and they can be treated and taken care of. But my general advice to everyone is to stay healthy, stay active, keep your weight down, don't smoke, make sure you're not diabetic or treat it correctly, make sure your cholesterol is perfect and treat it correctly, and I wish you many, many years of healthy, heart disease-free life, okay? And thanks everyone for helping with this.